Hey guys! Welcome back to the channel. Today we're going over a common class of medications called bisphosphonates using memory tips and visuals. So if you're ready, then grab your color pencils and let's color and learn. Osteoporosis is a progressive disease that leads to a loss of bone strength. The type of bone loss I'm referring to is where the bones are weakened, making the framework inside the bones more porous and brittle due to the loss of minerals. Yikes! It commonly occurs in women, patients greater than 50, Asian ethnicity, and those with a low body weight index. The more I'm learning about this, the more FOGO I'm starting to feel here, or fear of getting older. Why is this important? Well, osteoporosis increases the risk of hip, spine, and other bone fractures, leading to death and disability, especially in elderly patients. The drugs in this class are super easy to spot since they end in the same suffix, dronate, including alendronate, abandronate, and risedronate. When you think about this class, use this memory tip. The ending in the class name, bisphosphonates, sounds a lot like fossils. When you think of this class of bisphosphonates, think about how this class of drugs keeps your bones from becoming weak and brittle like fossils. This leads us to the indication for this class, prevention and treatment of osteoporosis in postmenopausal women. So why does this disease state unfairly target women? Thanks for asking. Well, studies have shown that estrogen deficiency is closely related to osteoporosis. During the menopausal transition period, the drop in estrogen leads to more bone resorption than formation. Other indications include osteoporosis in males, glucocorticoid-induced osteoporosis in those with a daily dosage of greater than or equal to 7.5 milligrams of prednisone or equivalent, and last, Paget's disease, a condition that causes the bones to grow too large and weaken. Some contraindications and precautions to keep in mind when it comes to this class of medications. Since this class of drugs can cause esophageal irritation and/or ulceration, it should not be used in patients with esophageal abnormalities or who are unable to sit upright, have difficulty swallowing, or have an esophageal stricture, or at high risk for aspiration. By preventing bone breakdown, bisphosphonates decrease the amount of calcium that is released from the bone into the circulation, leading to hypocalcemia. Therefore, it is important to correct hypocalcemia before use. Now for a jaw-dropping fact and something super important to note for exam is the warning for increased risk of jaw decay and/or necrosis with these medications. It is a rare condition and is unsure why it exclusively happens in the jaw. Last but not least, some of the medications in this class require renal adjustment, so it is important to be cautious in patients with renal impairment. Now, moving on to the mechanism of action. Bisphosphonates inhibit bone loss by blocking osteoclast activity. Osteoclasts are cells that break down bone, so think of the C in osteoclast as standing for the C in chip, since these cells chip away and break down bone. By blocking osteoclasts, less bone is being resorbed back into the bloodstream, and instead there is an increase in bone mineral density. In Paget's disease, the mechanism of action is a little different. Bisphosphonates work by indirectly decreasing abnormal bone formation and increasing new normal bone. For side effects, use the mnemonic bonehead to help you remember the main ones. Bone should help you remember the side effect of bone and/or joint pain. H is for headache or hypertension. E is for esophagitis. Remember back to when I said that patients had to be able to sit upright after taking these medications for a certain period of time? Well, that's why. A is for abdominal pain, dyspepsia, nausea and vomiting, and heartburn. D is for decreased serum calcium and/or phosphate. This effect is usually mild and transient. Finally, some important counseling points to tell your patients. Patients must take these medications as soon as they get out of bed in the morning on an empty stomach with a full glass of plain water. Sit upright waiting for at least 30 minutes and/or 60 minutes of taking abandronate before eating, drinking, or taking other medicines. To improve absorption, educate patients to take their vitamins with calcium, iron, or vitamin D 2 hours apart from bisphosphonates. Basically, avoid taking bisphosphonates with any divalent cations as they are known to interfere with the absorption of the drug. These medications come in different formulations that are dosed weekly or monthly. Ensure patients pay close attention to the dosing. Awesome job making it through the first part of the video, guys. Now on to the most important part, seeing how much of that information you can actually recall by using this visual review. First off, when you think of bisphosphonates, use the visual anchor of what again? Yes, a fossil bone for bisphosphonates. In our body, cells called osteoblasts help with new bone formation. You can recall this by thinking of the B in osteoblast as standing for B in build. In contrast, osteoclasts are cells that break down bone. You can recall this by thinking of the C in osteoclast as standing for chip. Normally, there is a balance between bone formation by osteoblasts and bone resorption or breakdown by osteoclasts. This balance leads to bone homeostasis or happy, healthy bones. Then comes osteoporosis, where there's an abnormal increase in osteoclast activity that isn't compensated by osteoblast activity. The bones become weak and brittle, increasing the risk of hip, spine, and other bone fractures, leading to death and disability, especially in the elderly. Bisphosphonates work by blocking which activity? Yep, you got it. It works by blocking osteoclast activity, the cells in the body that chip or break down bone. By blocking osteoclast activity, this leads to an increase in bone mineral density. For side effects, do you remember the mnemonic that we use to help us recall each side effect? Yes, that's right, it's bonehead. Bone stands for bone-in or joint pain. H is for headache or hypertension. E is for what again? Yes, E is for esophagitis. A is for abdominal pain, dyspepsia, nausea, vomiting, and heartburn, or anything GI related. D is for decreased serum calcium and/or phosphate levels. Last, let's review some of the key counseling points. You want to counsel your patients to take these medications when? Yes, take them first thing in the morning as soon as they get out of bed on an empty stomach and with a full glass of water for best absorption. Should they lie down after they take these medications? No, they should sit upright waiting at least 30 minutes if taking a lindronate or a zidronate, or 60 minutes with a bandronate. Alright guys, that's it for today. If you found this helpful, click that subscribe button for more. Let me know if you have any questions in the comments and I will be happy to answer them. If you're interested in getting more information from our Top 200 Drugs Made Easy coloring book, I will leave a link to the product below in the description, and I will see you in the next video.